Let's talk about blade geometry. So for my medic friends, you're yawning. This is super easy for you, but my nursing friends, unless you've worked pre-hospital, we usually don't know the differences in the tools that our physicians or respiratory therapists are using when they intubate our patients. We just know to open packages and hand them to them. But it's important that we understand this, especially if you're looking to get into flight, because you're going to be intubating patients. So the first thing we need to do is understand the anatomy of the oropharynx, or the back of the throat. And so it's not just a hole that you're looking for to stick a tube in. We've got the esophagus and the trachea, and we've got to differentiate between the two. Well, there's a lid that snaps shut over the trachea when we're swallowing things so that it doesn't go down our windpipe. Well, that windpipe is what we want. And so we need that lid open. It's also important to know the vallicula. I like to think of that as the armpit of the airway, right? It's the little connector piece between the tongue and the epiglottis. And we have to manipulate that when we're trying to force open that epiglottis to be able to stick the endotracheal tube into the trachea. In comes our two different style blades. We have our Mac. It's a Macintosh. We just call it a Mac for short, and it looks like a C in Mac. And then we have our Miller, and this is a straight blade. And the difference between the two is we typically like to use these Miller blades on pediatric patients because that epiglottis that's snapping shut over the trachea, it's not as cartilaginous. And so we will use this Miller blade to go in there and scoop under the epiglottis to lift it up and get it out of the way so that then we can insert the endotracheal tube. Whereas with larger pediatric patients, closer to puberty and adult patients, that valliculae, here the armpit of the airway, if we stick the tip of that blade right there and apply a little pressure, it goes, and it flips that epiglottis up, gets it out of the way so that we can insert the endotracheal tube. So there you have it, the differences between blade geometry.